5 years ago, the world changed. On March 23, 2020, then Prime Minister Boris Johnson announced a nationwide lockdown, a drastic measure designed to prevent the National Health Service, NHS, from being overwhelmed by a surging tide of critically ill COVID-19 patients. This unprecedented action, a stark turning point in modern British history, marks a somber anniversary, one punctuated by both reflection and a renewed sense of urgency. The initial lockdown, a period of unprecedented restrictions on daily life, was a response to the rapidly escalating health crisis. Images of overwhelmed hospitals, exhausted medical staff, and the chilling statistics of mounting fatalities remain etched in the national memory. While the lockdown successfully mitigated the immediate crisis, its long-term consequences continue to ripple through society, demanding ongoing attention and careful consideration. Experts are now raising a serious alarm, 5 years on, highlighting the enduring impacts of the pandemic and the need for continued vigilance. The anniversary serves as a stark reminder of the fragility of public health systems and the devastating human cost of neglecting preparedness. The lessons learned during this tumultuous period must inform future strategies, ensuring we possess the resources and resilience to navigate future health emergencies. Beyond the immediate health crisis, the pandemic exposed and exacerbated deep-seated societal inequalities. The economic fallout disproportionately affected vulnerable communities, exacerbating existing challenges and creating new ones. The scars of economic hardship, job losses, and disrupted education remain visible, underscoring the need for targeted support and investment in social safety nets. The COVID-19 Bereaved Families for Justice UK, a group representing almost 10,000 individuals who lost loved ones to the pandemic, has added its voice to the chorus of concern. This powerful coalition of grieving families, united by shared loss and unwavering determination, is lobbying the government to reconsider proposed cuts to disability payments. Their poignant plea highlights the ongoing struggles faced by those most vulnerable, emphasizing the human cost of austerity measures and underscoring the urgent need for compassionate and effective social policies. Their heartfelt appeal to Chancellor Rachel Reeves is a powerful testament to their resilience and their unwavering commitment to ensuring that the sacrifices made during the pandemic are not forgotten. They argue persuasively that reducing support for disabled individuals would compound existing inequalities, leaving many struggling to cope with the long-term consequences of the pandemic. Their campaign underscores the importance of remembering those lost and advocating for the well-being of those left behind. The 5th anniversary of the COVID-19 lockdown is not merely a historical marker. It's a call to action. It's a moment to reflect on the past, learn from the mistakes made, and redouble our efforts to build a more resilient, equitable, and compassionate society. The voices of experts and the heartfelt pleas of bereaved families echo a collective demand for continued vigilance, comprehensive support, and an unwavering commitment to safeguarding the health and well-being of all citizens. The lessons learned during this unprecedented crisis must serve as a guide for the future, ensuring that we are better prepared to face the challenges that lie ahead. Ignoring the warnings and the pleas for help would be a grave disservice to those who suffered, and a betrayal of the lessons learned during this profoundly challenging period.